so the discretionary dollars are at a premium. So it's tougher for people to make those kinds of well-being and health checkups that they normally would. But more specifically to the veterinary market, you've got several factors. First is a change in vaccine protocols from once every year to once every 3 years. So those clients that normally would only come in at time for time to re-up and revaccinate my animal, well, now they're only touching those clients once every 3 years. Another component is for flea medication, tick medication, any number of pharmaceuticals. They're able to obtain those online through places like Pet Meds and other online fulfillment houses. That means, again, they don't have to go back to the veterinarian, come through that door to get that prescription refilled. The last component would be the big boxes. The big boxes are not only, of course, playing in the retail-oriented components of that veterinary office, collars, leashes, that sort of thing, dog toys, obviously, but they've now also entered the pharmaceutical market. So they're able to supply some of those same things that the online fulfillment houses have. It's yet again another reason why traffic can potentially be down in some of these veterinary locations. There's one final consideration, and that would be the proliferation of these free spay-neuter clinics that we see popping up everywhere. Certainly a noble enough cause, however, it does tend to have a negative impact on some of that traffic that we would typically expect to come through the door. So from the perspective of the veterinarian, the question becomes, as a brick and mortar operation, essentially, if you will, a retail operation, the health of which is almost directly connected to how many times that front door opens and closes in a given day, how do I make that front door open and close more times in that same day? You're not going to be able to compete with the online fulfillment houses. You're not going to be able to compete with the big box retail locations. You're not going to get down and play in the free spay-neuter game and so forth. And you're not likely to change vaccine protocols of your own volition. So what's that leave you with? It leaves you with the ability to differentiate by virtue of offering services that none of those players will ever offer. The internet can't provide a laser treatment. The big box stores aren't going to have free laser therapy or reduced price laser therapy. They simply can't do it. You, as a qualified clinician, are offering a higher level of care that you're not going to find at a free spay-neuter clinic. So these additional services or value-added services that no one else can play in are how you generate that traffic again. And the nice part about therapeutic laser is it does require maintenance visits for those geriatric animals, those pain and mobility indications. We're not going to eliminate arthritis. We're going to mitigate it. And we're going to do a tremendous job at it. But just like anything else, it's going to require some repeat visits. What that means is the folks who are typically willing to spend the money on these kinds of treatments are oftentimes your A clients. You get more touches on those A clients than you ever would have through what you're doing presently. Each time that client comes in, it's another opportunity to interface with them. It's an opportunity for them to avail themselves of the retail components that you have available in your business and so forth. So that door is able to swing more times with your A-level clients. In addition, the off-menu treatments, or the itises as we call them, that vast array of non-pain and mobility related treatments also require, in many cases, some repeat visits and produce an outcome that creates word of mouth, where folks will bring those animals in. They may only require 1 or 2 treatments for an acute indication, but it's still more visits that you're getting than you're getting before.